care in Thailand. From a legal viewpoint, Thailand is a country which has a very progressive law concerning mental health. If we look at the statistics, we can see that there was a peak in suicides during the 1997 economic crisis. After that, the rate has stabilized, but there was, in 2014, with the economic downturn, another increase in the rate of suicide. And the Samaritan, the organization of Mr. Trakan, has been getting more call in the last 2 years. One of the issues in the field of mental health is also addictions. Last year there were 4,000 drug addicts in Thailand who tried to get help with mental health. And of these 4,000 people, a third were persons aged between 12 and 24 years old. To speak about this important issue tonight, we have 4 very experienced speakers. Please, if you can take your place at the table. First, we have Dr. Apichat Chariyavilat. Dr. Apichat is the spokesperson of the Department of Mental Health. He's also a general psychiatrist at the Sritanya Hospital, and he's a consultant psychiatrist at several other hospitals. We also have Mr. Trakan Chensi, who has been working for a long time with an organization called the Samaritan. The Samaritan is giving counseling on mental health on hotlines. Mr. Trakan is holding a master's degree in economics from the University in Washington. We also have Ben Weinstein. Ben Weinstein is a clinical psychologist. He has lived, worked, and taught in Thailand since 2003. He's a consulting clinical psychologist with Psychological Services International in Bangkok. And he provides psychotherapy for local as well as regional expatriates, specializing in anxiety, mood problems, addiction, and trauma. And then lastly, we have Mr. Craig Gagnon. Craig is the head counselor of the Cabin Bangkok. The Cabin is a facility. There are 2 facilities, one in Chiang Mai, one in Bangkok. They are giving counseling outpatient in Bangkok and inpatient in Chiang Mai. Craig is a psychologist and an addiction counselor. He has performed his clinical internship at the Mayo Clinic Psychology Department. He's a member of the American Psychological Association as well as the American Counseling Association. So we will start with presentation by the different panelists, and Dr. Apichat will be the first speaker. Please, Dr. Apichat.
สวัสดีครับ Good evening everyone. I'm Dr. Apichat Chariyavilat. I'm a psychiatrist and the spokesperson for the mental health Department of Mental Health. Today I'm very glad to be here, and because of long time did not go on stage with English speaking, so maybe I will use the wrong conversation, so sorry for now. Okay. For the mental health issue in Thailand, actually is mental health issue in Thailand has developed a lot for last decade compared to last 10 years ago. Thai people opinion about this thing or the ideas change. What changed a lot, and for the last 10 years ago is the mental health thing is very new for the people, such as depressive disorder and the sadness. Thai people still think it's like maybe it's the disorder not exist. It's just the people think by themselves. It's not happen maybe because of the weak mind, or sometimes in the suburban area they thought that something like a spiritual thing with the people there. But the last for the last decade, Thai people change their attitude a lot, and nowadays they come to see the psychiatrist and get the mental health services more and more. Compared to the statistic of the patient, the visitor at the National Psychiatric Hospital, the number of the client is much more than last 10 years. The last 20 years ago, most of the patients who come to the psychiatric hospital, most of them were schizophrenia. The problem that patient got the hallucination, delusion, and they have very poor hygiene and cannot blend in the social. But nowadays the schizophrenia is just only small part of all patients. Most of them nowadays is not got any disorder, something like just stress, normal stress, and they would like to improve themselves. Sometimes the teenager take the parent come to the hospital to ask for the help because they don't know how to deal with the parents, but no one got the illness, got the disorder in the family. So this is like a very new trend, and all psychiatrists in Thailand quite surprised about the trend for the last couple of years. But the major psychiatric disorder or major psychiatric problems still exist and still have the problem, such as schizophrenia, anxiety disorder, depressive disorder. This kind of problem still be the big problem, same as other countries around the world. For the mental health department, the Department of Mental Health, we nowadays we change from last decade. Before this, we have to be a center to wait for the patient come. But nowadays we try to promote and try to make the plan to prevent the disorder or the problem in the future. So we have more research and we have more plan, and the action plan that some action plan already success, and we try to keep the success rate in the future. Something like the suicidal issue. For the last 20 years ago, the number of the suicidal rate in Thailand is very, very high, especially after the economic crisis, the Tom Yam Kung problem. But after 4 or 5 years after that, Thai government try hard to support the information and try to be to give the information to the people in Thailand. After that, the number of the suicide rate go down a lot. Last year it's just around 6 people in 100,000 people that got the commit suicide. For the WHO criteria, they accept lower than 7%. This is quite a success rate in our country. But in long term, we try to let the number less than 6%, and we hope it will be lower than 6% in 100,000 people soon. I think maybe the suicidal issue, maybe the next speaker will give you many information, because the next guest will have many information about Sumaritan, the call center about prevent the suicidal activity. So I think this is very interesting, and I think it's really interesting information. So let's hear the next guest. Thank you. So I will be here to answer the question after this. In case of you have any question, we can discuss and we can talk after this. Thank you.
Thank you, Dr. Apishad. Please, Mr. Trakun.
Okay. Thank you very much. And first of all, I'd like to tell you I'm very delighted and also highly honored to be invited here to speak. And this is my very first time to come to the FCCT, and it's a very exciting experience. However, yesterday I found out, I was looking at the profiles of all the speakers, all the panelists here, and then I found out one thing. I'm the only one without a background in psychology here. So, that got me kind of fidgety, and it was a bit nerve-wracking. Nonetheless, I'm glad I'm here, and I'd like to thank Mr. Arnold for giving me an introduction. May I, with all respect, clarify a little bit? We don't run a counseling center. Okay, calling our work a counseling service is probably a misnomer. We don't do counseling, but what we do here at the Samaritans is emotional support to people who are in distress, especially people who are suicidal. We believe, our philosophy is that we believe in the power of listening, active listening, sympathetic listening. And we use that technique to help people who are facing challenges in life, and especially people who are people who feel that they're at the dead end and they have no one to talk to. So we fill the gap here, and what we do is we give listening service, and our people who work here are trained in active listening. Okay, because I'm not from a psychology background, maybe today what I can share with you would be from my experience instead of from my academic training. I represent the Samaritans of Thailand. For those of you who are from Britain, you are probably very familiar with this name. It's almost identical with suicide prevention in Britain. In Thailand, we are not very well known, but we have been here for 38 years already. And I myself has been involved since 1997, 19 years. We operate a call center where people in distress can give us calls, and the people who work there, our phones are manned by trained volunteers. These volunteers are not really experts in counseling or in psychotherapy or psychiatrists, or this kind of therapy. That's why I say we are not counselors. But our volunteers come from very diverse backgrounds. Of course, we have some psychologists working there, psychiatrists, nurses, doctors, social worker. At the same time, our volunteers also comprise of housewives, engineers, pharmacists, businessmen, economists like me, and teachers, lots of professions. And they come from different religious background, cultural background, but there's always one thing in common. The people who come and work here see the value of people's life, and they are here to help people. Generally, our volunteers would come in and they go through some recruitment process, and they have to go through some rigorous training for about 4 to 6 years. 4 to 6 months before they are able to man the phone independently. Basically, we receive about 10,000 calls a year in the past 2 years. This has been our standard number of calls. About 50% of those calls are suicidal, in that they have suicidal thought. I mean, not necessarily that they already have some plans, but they have suicidal thoughts. And one main thing that we have found out is that people who are suicidal, the principal reason is not because they face problems or face life challenges, because we all do have problems. But the main things that drive them towards suicidal thought is usually the feeling of isolation. They feel that they have no one to talk to, or they feel that whenever they talk to someone would dismiss them or pass judgmental comments. And that's like pushing them towards the corner and they have no one to talk to anymore. And that's why they call us. When they call us, we just listen to them unconditionally. We accept them unconditionally, and we provide all the emotional support that we can. And I think a very high percentage of our callers give up suicidal thoughts after several sessions, or at least the intensity of their suicidal thoughts decrease after talking with us, because they realize that they're not alone anymore in facing challenges, and they have someone like the Samaritans to walk along with them. So basically, this is what we do. Currently, we operate both Thai and English hotline. The majority of our calls are Thai, like 10,000 per year. That's mainly our Thai calls. Our English calls are in the lower hundreds, so still very few. But most of the English callers, when they call, they are very critical, and the problems are much more severe than the Thai callers. And I mean, if you have questions, then I can elaborate on that afterwards. One thing that we stress very much is the confidentiality of the calls. And therefore, we don't ask for the name of the callers. We don't ask for their phone number. We don't ask for their addresses. We don't know who they are. And this is why they are able to open up and talk to us about things that they have done that they may feel ashamed of, or they may feel guilty of, or things that they can't share with other people. So I think basically this is what we do, and I just would like to give you just a brief introduction about our service. And of course, we are also recruiting volunteers, but like I said, mainly we operate the Thai lines. Although we have the English section, currently we may not be in need of many English volunteers, but who knows in the future as more calls are coming in. So maybe just remember this, and one day we may be able to work together if you are interested in volunteering. So I think basically this is what I'd like to say. Thank you.
Thank you, Kuntrakan. And now we listen to Dr. Ben Weinstein.
Thank you, Arno. Good evening, everyone. I'd also like to thank the organizers for inviting me. I'm honored to be here. I don't know, I'd like to take a moment as a foreign guest in Thailand and someone who has benefited enormously from being able to live and work here, to just say I'm very sorry and offer my sympathy and condolences and respect to the Thai people, Thai nation at this moment in time. I'd also like to thank Kuntrakan and the Samaritans, because my experience over the last 13 years is they are, although the expatriate community is a small fraction of the calls they receive, they are providing a life-saving service, which many folks have benefited from over a long period of time. So I've been working as a psychologist here in Thailand since late 2003. And I think I want to share just a little bit about my personal experience, because I did what I now in retrospect consider a smart thing when I arrived. I think the temptation when a foreigner comes as a mental health professional is just to rent an office, put up a shingle, and start seeing clients. And when I came to Thailand, I didn't do that. I actually set about trying to get to know my Thai colleagues. And spent 6 to 8 months before I started seeing clients myself, just trying to understand what was going on in psychology in Thailand in 2003 and 2004. And it was a remarkably enriching experience. I don't have anything to offer, because Dr. Apichat is the expert on the mental health system in Thailand. But what I do know is that the people working in that system are remarkable, hardworking, devoted people. There are not many of them. Thailand, for every 100,000 people in the country, Thailand only has about 7.9 mental health professionals. It's not a fair comparison, but the corresponding number in America is above 100. But relative, Thailand's doing much better than any of her neighbors in terms of that number. But still, it's not enough, the human resource development issue. And so the people who are in the system are truly amazing. They're amazing in their devotion. They're amazing in their hard work. They remind me of folks that I worked with in the United States in the Veterans Hospital system. which is a system that gets maligned a lot, a system that gets bad-mouthed a lot, but a lot of the people working in it are very devoted people, trying to help people with serious problems. And my colleagues, the psychiatric nurses, psychologists, social workers that I've had the chance to work with here are really remarkable, and they're very talented folks. I think some very interesting stories there, especially in the way that they, creative and compassionate ways that they take Western models of mental health and counseling and selectively adapt them for use here in Thailand. It's enormously impressive what folks are doing. And in fact, I contacted several Thai colleagues to see if someone else would take my place here tonight, because I thought it'd be good to have like a Thai psychologist sitting here. And basically, they were all too busy. One studying cognitive behavioral therapy in Oxford. The Department of Mental Health is paying for him to go study cognitive behavioral therapy in Oxford so he can come back and teach people. Another one said, I've got to do stuff with my students. I don't have time to do that. Another one didn't respond to my email. I think folks are working really, really hard in the Thai mental health system from top to bottom, and with really difficult problems. With respect to expatriates, it's a really, and you ask like, what are the kinds of problems expatriates have? It's a remarkably diverse group of people. Because all you have to do is ask yourself the reason, not even including tourists or visitors. Just ask yourself the question, why are different expatriates coming to Thailand? And you might immediately divine that there's a lot of different populations here. So you have folks, professional folks, who come here to work. They work in corporations, they work for NGOs, they're diplomats, they work for the United Nations. This is one tranche of people. You have people who retire here, right? This is a fairly different group, right, with a different set of needs. You have, we increasingly see the people, the folks in their 20s and 30s who are the digital nomads, right, who are here because Thailand is a convenient place to live while they're doing their work in Europe or North America or somewhere else in Asia or Japan. You have entrepreneurs. There's another group of people, smaller group of people who come here because they want to start a business and run something. And there's other groups as well. These folks come with different needs and they come with different issues. I think that three of the things I think that are interesting from my perspective as mental health issues in the expatriate population are, of course, the classic issue is what is usually referred to as the accompanying spouse or accompanying partner. That is to say, someone who had a job and was productively engaged in their home country, and then their partner or spouse got a job here, and so they're coming along. And the problem is that it's psychologically very difficult to go from being productive and employed to not being productive and employed. Right. And that takes a tremendous psychological toll on folks. The second issue that we see in the expatriate community is that kind of, in all of our home societies, in virtually all of our home societies, people are very busy self-organizing things like support groups and activities where people can just engage in things and meet each other and support each other. There's real poverty of that here in Bangkok. So once people encounter a mental health issue, it's very difficult for them to use some of the alternate resources that we would rely on as psychotherapists in the West. Again, this absence of kind of social support systems which leads to the third issue. When a foreigner falls, they fall harder and farther than Thai people fall. Because the kind of safety nets, especially since most foreigners don't really bother to learn Thai in any significant way. And therefore the systems that are in place that they could benefit from, if they could communicate proficiently in Thai, aren't really able to assist them, even though they're ready to. The people at Somdet Chowpraya and Sitanya Hospital are ready to help foreigners in distress, and the Samaritans are ready to help foreigners in distress. But the problem is that many of those foreigners don't speak Thai at all. And of course, the folks working in the Thai mental health system, they don't have time to learn English, right? That's not I don't think that's appropriate or justifiable for them. And of course, I think the last issue, the last point, which to me is very psychologically interesting, because my area is kind of around emotion regulation and trauma, is that Bangkok is a place where the external environment doesn't have many of the limits that are in place in our home societies. And many people, you may not realize this, but many people rely on those external limits. They're not controlling themselves, right? But they're responding to what's available and what's not available in the environment. And some of those people come to Bangkok, and suddenly there's a whole bunch of stuff available in the environment which can be delivered to your door 24 hours a day, accessed at literally any moment with just a phone call. A whole bunch of things that are not so good for people. And a good number of those folks go off the rails. Because they're suddenly in an environment and they've never had to develop that internal self-control. So that's another group of folks as well. And they might come from any of those groups. So that might be someone working in an embassy or in the United Nations or a retiree. And that kind of problem very quickly gets out of hand. And I'm also happy to take any questions folks may have. Thank you.
Thank you, Ben. Please, Craig.
Hello, my name's Craig Gagnon. I'm a counselor at an outpatient mental health and addiction facility here in Bangkok called The Cabin. We've had a presence in Chiang Mai as a residential addiction program for about 7-8 years, but we've only been in Bangkok for about 1.5 years. A lot of things have been covered so far by the other speakers, so I think what I might share is some of the issues that we see the most at my office. We serve both Thai and foreign clients. We have staff members from the Philippines, India, Thailand, the US, so we have multiple languages available, but the majority of our clients are either Thai or English speaking. Anecdotally, we tend to see more mood disorders in our Thai clients, being depression, bipolar, dysthymia, and definitely more anxiety disorders in our foreign clients. About 70% of the expat or foreign clients that come in are suffering from some type of anxiety disorder, sometimes social phobias, post-traumatic stress, panic disorder, but primarily generalized anxiety disorder. So that for those of you that aren't in the field, it's basically described as being in a constant state of dread or foreboding. Something's wrong, but you don't know what it is. You can never relax, and you're always on edge. Interesting enough, most of those people don't have a previous diagnosis. They didn't come to Thailand with that disorder. The majority develop it after living here 6 to 18 months. You know, we don't have an explanation yet. Is it just a higher stress environment outside of their comfort zone that makes them more aware of their anxiety, or are they taking on more obligations, more challenges than they previously had? But we see quite a bit of that, and it's across different populations. NGO, embassy staff, working professionals, sometimes students, occasionally retirees, but quite a bit. And we're grateful that people are seeking help while they're still functioning, when they recognize the first signs. Often we don't see people that go off the rail, as Ben said, or who hit the wall. Those that don't seek help, usually by the time they can't function anymore, they've lost the resources or the support that they need, and their only option is to return to their home country or perhaps do something to harm themselves. So whenever we see someone come in early, we're very grateful that they took the initiative. What we also do here in Bangkok is addiction treatment on an outpatient basis. So we do both chemical and process addiction. Process addiction are behavioral addictions not related to drugs or alcohol. The primary ones that we see are sex and or love addiction, gambling addiction. We're starting to see more, believe it or not, social media, Facebook, Pokemon. People are actually starting to seek help for computer cyber-related addictions. On the gambling addiction part, primarily what we see is online gambling, sports betting, usually on their smartphone. Where 20 years ago it would have been the underground casinos or crossing the border to Cambodia or flying to Macau. Now people, while they're in Starbucks, they're dropping 12 million baht in one afternoon. We're starting to see that. Unfortunately, people are usually quite a bit in over their head before they seek help on that. And the reality is sometimes they went through other resources and they're unable to get professional help by the time they hit the wall on that. On the chemical addiction part, my parent organization in Chiang Mai does residential addiction treatment. And generally speaking, that's preferred if it's an option. A residential facility where a person's sequestered, a holistic approach, medical stabilization, and a healthy environment gives the person the best opportunity to overcome their addiction. For some people, it's not a possibility. For working professionals, they may not have the funds or the insurance might not cover it. Their employer will not let them have 30 or 60 days off work, or they're in a very vulnerable, high-profile position where they can't come out to their employer and tell them that they have a problem. In which case, we offer outpatient counseling to work around their schedule whenever possible. You know, what's interesting is that every drug in the world is available in Bangkok. From cocaine from Colombia, to heroin from the Golden Triangle, to khat from Northeast Africa. If a person is seeking a mood-altering substance, they can find it in Bangkok. But then again, when a person's not looking for it, it's not really visible. So I've talked to people that they said, for 4 years in Bangkok, I didn't do drugs and nobody offered. And the moment that I got into it, all the dealers could spot me coming, you know, and I couldn't walk down the street. So we see a lot of different problems. As in most facilities, alcohol still remains the #1 addicted mood-altering substance. And a lot of people get a little farther into their drinking problem that they might in their own country because their peer group, their social reference group, it's normalized. Mm-hmm. So if they were drinking 3 martinis at lunch in Manchester or Manhattan, somebody might say something, but with their peers in Bangkok, it's a little bit more acceptable. In Thailand, they're often surrounded by tourists, so it might seem like everybody's drinking at any given time. I'm bored. If I want to socialize, I have to go to the bar. That's where I'll find other English speakers. So often their drinking problem tends to sneak up on them before they really realize they have a problem. Another one that's making a resurgence is we're seeing a lot more heroin addiction. In the 80s and 90s, when people finally realized that heroin was not a social drug, what the effects were, it went down quite a bit, but in this decade it's coming back up. And we're not seeing it at the street level. We're not seeing it under the bridges in Klong Toi or necessarily the clubs. We're seeing people in high power positions, high profile positions, professionals that start to experiment because they think, well, I can try it once or twice just for kicks. I have enough willpower, I won't get addicted. And then eventually they have to seek out help for it. The last thing that we tend to see quite a bit are the unintentional drug addicts. And probably a good third of our clients come in with addiction to benzodiazepine. They Valium, Ativan, clonazepam, and normally they didn't seek it out for a recreational purpose. It might have started with anything from buying it off a card table on Sukhumvit to over the counter at a pharmacy or being prescribed to help with sleep or, you know, with stress. But taking it, not realizing the potential dangers and not taking it as prescribed, it's a very difficult drug to stop once one becomes physically addicted to it. And we're seeing a lot more people that struggle with being a drug addict because they're not a club kid, they're not on the street, they're not a drug addict, they have an addiction to a prescription, but they feel that the normal routes for treatment may not be appropriate for them because they didn't do it for fun. They became addicted accidentally. So we see a wide gamut of addiction problems, and I'd like to thank the selection team for inviting me here, and I'm welcome to answer any questions with my counterparts. Thank you.
Thank you, Craig. The floor is open. Please, anyone can ask a question. State your name and your affiliation, please. Please.
I would like to know
The microphone is you can go to the microphone, please.
Thank you for having me here. Craig, I would like to ask you if you can go more into talking about modafinil and aniracetam, the smart drugs, because you mentioned a few.
That would probably be a topic that the doctor could better address. I'm not a medical professional, so I don't state opinions, and I try not to get into discussions about pharmaceuticals. If one has a problem with that, then I can discuss how to quit, but I don't get into a debate about what's a safe drug, marginally safe, what has benefits. That's kind of outside of my area.
Hello, my name is Adam Ramsey. I'm with Radio Television Hong Kong. I was interested in what, Craig, you were saying about noticing the different trends over time, how heroin addiction is going up, and I was wondering, in terms of the Ministry of Mental Health, as outreach programs get better, are you noticing any trends sort of nationwide, by region, in the cities compared to the rural areas?
Outreach in what aspect or what type?
I mean, in terms of basically having people, what Kun Apichat was saying about people having a better understanding of mental health, and as data gets in, which is a bit better, have they noticed any trends in the sort of like grand schemes?
Probably the most promising thing that I've seen when I came to Thailand 7 years ago, as far as I know, there was not one 12-step support group in Thai language in Thailand that I knew of. The support groups are a wonderful option for people that don't have the resources for professional services, or maybe they've completed it and they need follow-up. And the big ones in Thailand are Alcoholics Anonymous and Narcotics Anonymous. Today there are AA and NA meetings in Thai language with Thai literature that's fairly recent. And I'm aware of some exclusive Thai groups in southern Thailand that was started and has been maintained by drug addicts that are maintaining recovery through support groups, which isn't a traditional model in this culture. So I'm actually seeing more openness and more willingness for people to discuss and get help with their problems in that manner.
Jack Kelly, I'm a local resident and business owner. My question, I have two questions, please. First, is alcoholism or drug addiction classified as a disease in the Thai medical community? First question.
For the drug addict and alcohol dependent and any substance dependent is the all of them is a disorder, the problem of in psychiatric problem. As Craig said, actually in Thailand there are many drugs and many choices for the addictive people to choose, but the most common thing is like alcohol, because it's like a legal substance to use. So as Greg says, in many cases we found that there are many disorder behind or up, maybe in many hospital or many center after we treat the people who got addictive with the alcohol addictive or substance addictive, we found that there are many psychiatric condition behind that. That may be because of the actually we found that the intoxication of alcohol or intoxication of the substance will cover the symptom of other disease or other disorder. So that's why many psychiatrists around the world or in European country or USA cannot find it. We found after they stop the alcohol for a while and the other symptom or other condition will show up. And in many cases, we found that they use alcohol or many substance because they got the problem or disorder before. That's why they use the substance or alcohol as a self-medicated. So all disorder and actually it's not because of the people take it and feel good and just only feel good and take it more and more. Those alcohol and substance will affect the brain. The function of the brain will not stabilize or not stable anymore because of the in the common term the substance and the alcohol will affect the function of the receptor in the brain. So they need to take it more and more to maintain the good feeling and the circuit in the brain. When the people stop it, they will got the withdrawal symptom. That's why they cannot stop it. So it's become disorder.
I see. It's a mental disorder. Thank you. How many alcohol and drug addiction treatment facilities are there in Thailand? Maybe I can ask the question, how many inpatient beds? When we talk about hospitals, we talk about beds, right? Number of beds in a hospital. How many beds are there in inpatient facilities in Thailand for drug addiction or alcoholism? Does someone know the numbers of these?
It's quite hard to estimate exactly bed for the drug or the substance problem because nowadays, as other countries around the world, most of the ward for the patient they will include in the psychiatric ward. They will be with other patient, other problem, but just only some situation or center like the cabin, they just only the alcohol addictive or the substance addictive. In Thailand, there are many group of many type of the hospital, such as in my hospital is like only psychiatric hospital, so we have the specific ward for the alcohol, but sometimes some period the patient come to treat more than the limit of the bed. We send them to stay in the general psychiatric condition ward, so it's quite hard to say. But in Thailand there are 18 hospitals of the mental department of mental health, and also have the general hospital. That means they are all condition or medical condition. So sometimes the patient with alcohol intoxication will go to stay in the general medical condition ward. So it's quite hard to estimate the exactly number of the bed.
Okay. We've heard about Alcoholics Anonymous and Narcotics Anonymous tonight was mentioned. Are there any other community-based approaches to alcoholism or drug addiction in Thailand or Southeast Asia?
In Thailand, we have many process and many systems to help the patient who got the psychiatric problem, not only in the alcohol problem or substance problem. We try to let the community help. So in Thailand, for the local village, like a local หมู่บ้าน the village, they will have the staff like a obata or the head of the village to build the network in the village. When the patient go back from the treatment to the community, the team will go to take care. But not only the team of the village, they are the bigger network, like in the one tambon, the collection of the village, like they will send the people from the collection of the village to train in the to train with the Ministry of public health to take care of the people who got the general medical condition, especially the people who got psychiatric problem.
Please, maybe if you can.
I thank you. I was just going to ask if any of the other panelists would like to speak to the questions that I raised. Thank you.
You know, I think that Thailand probably has better and more thorough numbers, according to the WHO reports, than the other countries in the region. And those reports are available online. So the Department of Mental Health has been more thorough in collecting the data here in Thailand. You can't get such good numbers for Cambodia, Myanmar, Malaysia, or Laos. And I think that the situation's always developing. And I think that there's some interesting things happening out in the rural areas. So I had a student from north central Thailand who was kind of organizing her own treatment center in her community because there weren't any facilities nearby. Patients had to drive for 2 hours to just get a prescription refilled, which can happen anywhere, not just in Thailand. And you know, that she was working with models to develop a kind of community, like get people in the community, because they work as a family, to bring their relatives in, do some kind of psychoeducational groups, and give some of the more seriously mentally ill people kind of a place to go during the day. It was an amazing kind of thing to learn about. And she did her thesis on studying her own project, and you know, Craig mentioned that in the last few years we've seen the development of support groups in Thai language here in Bangkok and a few urban areas. So I think that there's probably really interesting things happening around the country here and there, you know, and that's, I think, extremely encouraging.
Hello, I'm Stephen Holroyd. I've been working in Thailand for 13 years in the international school context. And first of all, I'd like to just thank everyone for raising this incredibly important issue tonight. And I'd like to, first of all, concur with Dr. Ben in respect of those remarks about the amazing professionals working in this field in Thailand. I think for those of us who've had first-hand experience of that, everything that you said resonates. Working with young people, I'd like just to pick up on something that Craig said, if I may, and that was about the sort of accidental slip into addiction that you were talking about, and obviously you were talking sort of about a sort of post-Prozac context. I wonder if there are any thoughts about that slip into unintentional addiction through the sort of technology that dominates young people's lives these days. You mentioned the online addiction to gambling and the access via the smartphones. Is that something that you are generally concerned about, that young people who, well, not just young people, people using their technology in a regular way can slip into an accidental addiction in the same way?
I think it's safe to say that the easier access there is to a addictive behavior, the more likely some people who might not otherwise engage in it will. Certain people are generally drawn towards extreme or high-risk behaviors, and if there's not easy access, they'll find a way, where other people who might pass it by, if it's put right in their face, will access it. When we talk about cyber addiction, currently, Japan and South Korea already have specific computer, internet, social media, inpatient addiction treatment programs that's generally for younger people, teens, early 20s. The rest of the world hasn't quite caught up on that, but it's, you know, you bring up a good point. An individual who may not have the personality profile that they would fall into drugs or drinking or sexual behaviors might become a bit enamored with something as safe as Facebook or Twitter or video games and find themselves technically addicted to that, what they thought was a relatively safe activity. You know, what we find in the field is, on the one hand, almost everything in moderation is relatively safe. And almost everything in excess can become an addiction to the individual. So you bring up a good point, and I think we need to keep, I'm definitely going to monitor my children's technology use as they get older.
Good luck. Hi, just one more. This is for everybody. I'd be really interested to know what each of you think is, on the sort of grand scheme of mental health problems, is there one thing in particular that you think is particularly in need of addressing, or it needs some more support, or is there a problem that is very particular that you think is needs to be addressed? That'd be great.
Okay, I cannot call myself an expert. As I said, we are not really into counseling, but I speak about this from my experience, from our experience as a Samaritans providing service to distressed callers. One thing that we have found that it's quite common among our callers is the feeling of loneliness, depression, and isolation. And this is something that we find increasingly critical in Thai society these days. I remember when I was young, Thailand was kind of really poor. And in my whole family, we only had one TV, one television set, and everyone would sit together and watch TV. And so there's this kind of sense of support. But now the economy has grown, and now all the kids, once they get home, they go into their own room, playing with their social medias. Everyone has his own computer, and there are increasingly there are less and less time spent together among the supporting family members. And this is something that I think has driven a lot of people into depression, into suicidal thoughts. So I think if there's one thing that is quite critical from the Samaritan's perspective is the support network, especially family support network, has to be rekindled among Thai families. And this could substantially reduce the risk of people committing suicide.
Anyone else?
Yeah, Ben.
Again, if anyone's interested in numbers, I can't speak for Thailand, but globally, if anyone's interested in the numbers, the WHO data suggests that there's a global epidemic of loneliness and depression, and that the WHO, within the next, by 2020, depression itself will be the single biggest cause of lost productivity in the world, more than any other medical or mental health condition. And that's kind of shocking. And it's very interesting. And I think that manifests in all societies at this stage. So we can see it in Thailand, and the doctor talked about how the Department of Mental Health is doing everything they can to work with the adolescents and the kids we're talking about. And I think you see it in all of our home countries as well. There is a really, really big issue there. People have more now than they've ever had. We're so lucky to have been born in this time and in these places, but because we have more than we've ever had, but people seem to be very significantly less happier and less satisfied with their lives. That is really something worth being curious about.
Thank you very much.
Hello, I'm William Waite. I'm a psychologist and a musician. In America, there's a new, it's relatively new field they're calling mindfulness training, which is kind of like Buddhism light, and they've taken some of the Buddhist meditation practices and put them in a little package for stress release. I'm wondering if there's been any attempt from the psychiatric or psychological community to wed with the Buddhist community in terms of looking at mental health and prescribing meditation and some of the deeper aspects of Buddhism into a psychological format.
Nowadays in Thailand, there are many psychiatrists interested to take the meditation or the Buddhism idea to help the patient with many psychiatric condition. For the last 5 or 6 years, in many countries, as you said, many countries interest in the meditation as something like the meditation oriented. So nowadays we use the theory of the Buddhism to be the one part of the psychotherapy. Especially in Thailand, it's like a Buddhism. I'm not sure in English word, but it's it's like a philosophy of Buddhism psychotherapy to let, because for the Buddhism logic is they use a logic, maybe they have the cause and they have the result, so they let this idea to train the patient to use the logic more and more. This is one part of the psychotherapy, and in many hospitals and many centers use the meditation to help the patient gain the insight, gain the concentration, but they have some limit of the meditation. In case of the patient got the severe psychosis or severe depression, the meditation will induce psychosis or worse the problem. So we will use in the case that a little bit more stable and under control of the psychiatrists and psychologists in Thailand.
You know, I think that when I was speaking, I mentioned the creative ways that Thai psychologists have adapted Western counseling models, and this is exactly one of the ways, although there's others. So, for example, Ajahn Suri Prakau at Chulalongkorn University had, 20 years ago, developed a Buddhist counseling group therapy model, right? That is a kind of non-stigmatizing, group-oriented, collectivist-oriented counseling model that has been widely adapted in a number of schools, a number of places in Thailand, and seems to be very effective in getting people to open up and talk about stuff and then receive guidance in kind of a Buddhist framework. So that's one example. I'd also like to respond to what the questioner said about, can we get more Buddhism into psychotherapy? I think that as probably all of you are aware, because I think all of you probably follow the media, mindfulness, there's been like this mindfulness explosion in the West. And that's probably a really good thing for a bunch of, there's a bad side to it, but it's probably a really good thing. And I don't think you have to bring the Buddhism into it. There's a lot of good evidence, and I think the Buddha, honestly, and I hope this isn't disrespectful, I think the Buddha would agree with me, okay? Because the Buddha said there are 84,000 Dharma doorways, okay? And that the finger pointing at the moon isn't the moon, meaning that it doesn't matter what we call something, right? If it's useful and if it helps people, right, then we should bring it to them in whatever way that they can receive it, right? So you don't have to practice mindfulness meditation, and you certainly don't have to be a Buddhist to benefit from mindfulness in whatever form you call it. So, and I think that especially for a lot of people who might otherwise be open to it, I think it's great if someone wants to go to the Wat, do a retreat. I think that's an extremely helpful thing. But if people have a reaction to that, they can still benefit from mindfulness in a whole bunch of ways without learning how to sit and meditate.
Hello, my name's Clesa Wilson.
I'm Yasmin Nguyen.
We're local students in Bangkok. Just throughout the entire talk, you used the word people very generally, and I'm just curious as to, like you're talking about the 10,000 people who call up. What age demographics are these people? Okay,
demographic of people who call our center. I would say about 50% are people in the working age, about 30 to 45 years old. 75% are women. Interestingly though, our English line, 90% of our callers are men. And I think there's a very interesting reason for this. Okay, let's talk about the timelines. You know, each year the number of people who committed suicide number around 4,000. Of this, about 3,000 are men, and about 1,000 are women. But the callers who call us are 75% women and 25% men. There's a reason, you know. Generally, men by nature are a little bit more aggressive, and they are less reluctant to share their problem with other people. And so when they think about committing suicide, they would usually resort to violent means, like, you know, shooting or jumping, which would kill them successfully. Women, on the other hand, would take medicines or, you know, poisons, which would probably has a higher chance of survival. Also, women are more likely to share their problems. So by speaking out, and this is where we come in, we offer a listening service. By speaking out, this would greatly, significantly reduces the desire to commit suicide, because they feel that there's someone close to them. Okay, let's talk a little bit about our English callers. 90% are men, and 90% are also highly suicidal. I think this has something to do with the nature of the expatriate community here. I don't know if this is representative of the expat community, but among our callers, this about a very high percentage of the problems discussed are intercultural difference within the family. A lot of our callers have Thai wives, and first of all, there's this problem about, you know, cultural difference, and also many of them, this is sad to say as a Thai, but many of these foreign men, after they got married for a while, they were cheated by the wife financially and also in marriage. And eventually they're left to themselves. They have no one. And they don't want to go home. They have no one to turn to back at home. And so they're in a very desperate state. If their visa expires, they're penniless because the wives kind of hoodwinked all the money, and, you know, they agree to support the whole family. And they also, a lot of them found out that, you know, the brothers or the brother who live in the family are actually the wife's lover. You know, so basically things like this, these are very critical, and eventually they're left with no support system because they are here all alone by themselves. Their families have deserted them, and they call the embassy, and the embassy cannot provide any financial assistance or anything. So there's no one left. They call us, and we try to help them. So a lot of them are very critical. So this is the demographics.
With the people who call you, do you ever get teenagers or young adults who express suicidal thoughts?
Yes, yes. Our youngest callers are about 12, and the oldest is maybe around 80. So it's quite a diverse group, but the majority are working age. Yes, but we do have teenagers who call us. The main problems are family problem. Parents don't understand them, and they feel that they're all alone. A lot of them have suicidal thoughts. And they also have pressures about friendship, about friends, peer pressures, acceptance among friends, and also academics. So yeah, we do have young people calling us.
We've talked a lot about treatment, and I was wondering what sort of preventative action has been taken. And you also mentioned that there's a very diverse range of people, so I was wondering how you change these preventative actions to suit different types of people.
Okay, first of all, we don't do treatment. We are not experts. We are volunteers.
Right.
Okay, we're not trained in psychology, or we are not psychiatrists. What we do is we train our volunteer to talk to them, to listen to them, and to give them unconditional emotional support. We are not able to go beyond that, like prescribe medicines or anything. We are not experts at all. But by doing this, we think that we feel, and actually it has been proven because our callers keep calling back, and they told us that by just providing this support, a lot of them feel that this is already a big help. Of course, if they have chronic mental health issues that need medication and real treatment, we would refer them to the institutions that need help. But basically, you asked about all the different age groups. We apply the same principle. We listen to them unconditionally. We accept them and we never judge them. And we make them feel that they are not alone in this world, but they have us.
Thank you.
There have been reports about foreigners with mental health problem begging on Thai streets. How significant, how sizable is the phenomenon?
Could you?
Foreigner with mental health problem begging on Thai street, on streets in Thailand. Is it a sizable phenomenon?
With our callers?
Yeah, I'm asking the question to anyone. Yeah.
For the foreigner who come to Thailand, about the number, I'm not sure the exactly number, because most of them will go to the private hospital or the foreigner clinic. So not much people come to the government center. So maybe Ben can.
You know, there's been a number of media reports, and I think that's the main source of information at the moment about these homeless foreigners, especially in and around Pattaya. And this is, I think we can speculate. I think there's probably a number of factors that are involved. I think that it reflects that more non-functional people are kind of showing up here, because, as you know, Bangkok is, again, people turn on the television or read in their news feed on Facebook that Bangkok is the #1 global destination, right? And many mentally ill people in our home countries receive a monthly check, right? They save a little bit of money, they buy a cheap plane ticket to Bangkok, and they rapidly end up homeless. I suspect there are other people who deteriorate in the situation that Kun Trakan just described to us, the kind of tragic things that happen as a result of bad decision making. And I also wonder if it also reflects the fact that it at least anecdotally looks like the number of these homeless foreigners are increasing, may reflect some changes in Thai society as well. You know, that attitudes may be different, where a landlord 20 or 30 years ago, if some foreigner was acting a little bit weird and wasn't paying the rent, the landlord would carry that person for 5 or 6 years. So I think we've all heard of that kind of situation, because people can be extraordinarily generous and compassionate in ways that certainly wouldn't be true where I came from. But perhaps there's maybe just a little bit less of that, especially in the area around Pattaya, where people have just so much experience with being with foreigners. I don't know. That's literally a personal opinion, and it's more like not a question more than an opinion.
Just the one thing, when you mentioned mentally ill foreigners begging, I think we might be looking at two different populations, where the mentally ill, the expats that disappear, get into trouble, and we see the notices in the newspaper or the media, somebody's gone missing in Thailand. Generally speaking, the beggars aren't necessarily mentally ill, as we might see in more Western countries. It can be a more lucrative employment than actually working if you have the right location. But as Ben said, we've seen a lot of individuals from the West that already have a mental illness. They're on medications. They come to Thailand because it's their right, just because they have a mental illness. What I tend to see is when they end up at the parties or the full moon parties, and a lot of psychotropic medications are very tentative, especially if a person is bipolar or schizophrenic. When you add large amounts of alcohol or ecstasy or marijuana or something else, it tends to throw off the effectiveness of the medication, and then they may stop taking it completely. So I think a lot of the mentally ill foreigners we see in Facebook postings or online, were okay when they got here, but a lack of self-care and knowledge about what they needed might have been what led them to become non-med compliant and made their symptoms exacerbate.
Thank you.
Hi there, my name is Sunny. I'm from Canada. I'm an entrepreneur, manage a small company out here.
Can you speak nearer the
Sure.
microphone, please?
My name is Sunny. I'm an entrepreneur from Canada. Own a small company out here in social media. I have two questions. The first question is that we've noticed on social media in the last few years that people act very differently. How they would in the normal world and how they would respond to other people. It's not specifically to Thailand, however, it can be incredibly harsh, incredibly rude, quite quickly. Our job is to neutralize that and to make sure that things go in a positive direction, but I'm very curious about your thoughts, and I'm opening this up to the panel in terms of, is this something new we're seeing, or is this a reflection of just another type of personality? Because the diversion is extreme. Normal people acting incredibly strange when they're anonymous, for instance, on social. And I guess the second question, I'm opening this up to the panel as well, is that, you know, considering everything that's happened the last few days and the mood that everyone is in, if you had any recommendations about how we, all of us here, can take action after this meeting, what would you recommend in terms for us to spread this word about support out in the network?
I'm sorry, I didn't hear very well because you were talking a little bit off from the microphone. But from what I gather, you were talking about social media and how harsh it is that people are commenting these days.
It's this very different personality that can be shown on social media versus what they are like in real life, through comments, through you know, ganging up on situations. It's can be quite bizarre. So I'm curious about your thoughts about that in terms of, I'm not sure, it's very new to all of us, but I wouldn't call it a disorder, but I'm not an expert. But I've seen it, even an average person exhibit comments that are just, you would not see in everyday life. And the second question was in terms of, you know, an example, maybe I'll just give an example, and then is that after the recent passing and everything that has happened, when we were looking to do searches for the team to provide them support, it wasn't as common, it was very difficult to find support for people who needed it, like whether call centers or whatnot, relative to other countries, whereby it's almost ubiquitous, like call this number for support. It required a lot of effort. So what can we all do in this room after today to help spread the message for people who would require assistance?
So the psychologists have a term for the effect you're talking about. It's called online disinhibition, and they're very busy studying it to figure out what's going on. It means that people who might, in a room like this, would never dream of saying something nasty to someone, alone at home could be horrible. And I think fundamentally, I mean, I don't want to, like, I already said disinhibition, and I don't want to use more words like that, but fundamentally it's the kind of monkey that we are, right? When we're together in a group, we act better than we're alone sitting in front of a computer, right? I mean, that's just, I mean, you may not like it that I said that, but that's kind of human nature. We make each other better people when we're around each other, in general. Also, bad things can also happen under some circumstances. This online disinhibition, if you Google that, you'll find all kinds of research and what people are studying about that. I don't think much research has been done in Thailand about it, but I think it's I'm going to leave that to Dr. Abhichat or to Kun Trakan to comment on.
Actually, this is really the first question. I think it's a very big problem around the world, especially in Thailand, because Thai people use the social media a lot, and it's like approximate about 16 million users of the social media. So we concern the government concerned about it, because some people cannot control themselves. It's like a self-control problem. But in fact, I think the social media or the technology is not the problem. The problem is the people cannot control themselves, or they don't have enough self-limit to about using the technology. So nowadays, Thai government try to promote how to let the people control themselves, and how to teach the junior to being with the technology with something like a time limit, and the content that we think is appropriate to the age. For the last couple of years, Thai government try to promote something like for the young children, they don't maybe not appropriate to use the like a tablet or any computer for the very young, something like a kindergarten or the primary school. Maybe when they go up to the primary school, they use something like a limited time. But the technology is not that bad, because nowadays we use the technology or the social media to prevent the other problem like a suicide. There are many research show that technology can also the social media can reduce the suicidal activity, because the people around the patient or around the people who got the problem can detect earlier than before, because something like a message or something. So nowadays we try to let the people use it appropriately. So I hope in long term the number will be better.
May I comment a little bit on this? Again, I'm not speaking as an expert, but from the phenomenon that we have observed at the Samaritans, we find that social media actually is a double-edged sword, and increasingly it's getting more dangerous. Especially during the time when we have this color-coded political divide, or you can see on social media is that, you know, when someone posts something, and then if it's on a page of of a certain side of the political spectrum, a lot of people would come in, the supporter would come in, and if someone voiced something differently, you know, they would be bombarded with very, very severe, very rude, brutal comments, like cyberbullying. I'm not sure about this, but from my personal guess, I think this is kind of like human herd mentality. You know, when you criticize a person and then you get support, then the more support you get, the more you would do it. But this is actually very dangerous, and I've seen, you know, sometimes people post something that is kind of like very, you know, post a status that's really nothing harmful, but it doesn't suit the liking of certain people, and then they would come and bombard. One thing that is already happening right now, and is really a big concern, I think, is, you know, with the recent passing of the king. Of course, Thailand, everyone is in mourning and everyone is sad. But at the same time, there are people who think differently. And if they post something just a little bit different, they will be bombarded with lots of bullying. And now we already have lynching and, you know, also public attacks, slapping and public shaming. A lot of things are happening. And this is something that is really of high concern. Of course, here we love the king. But I think for people who think differently, they don't really deserve that kind of treatment. And there's a legal code, there's a law to take care of that. But I think still it's a very, very sad thing that is developing, and I hope this would die down.
And in terms of things that you feel that we can do today or tonight or tomorrow to help spread the word in terms of the support network available, do you have any recommendations in terms of what you feel we can do?
Well, from our perspective, I think, real family support or, peer group support, that's very important. It's very good to still care for people. We are getting increasingly isolated and we're getting increasingly individualistic in our society. If possible, let's go back to where we were before in certain ways. Okay, support, be accepting, give unconditional support, no matter whether you disagree with how other people think. See the value of people and give them support. Listen to them when they're in distress. I think that would help. Okay, this is the Samaritan's perspective.
Next question. Yeah.
Good evening, Sawadee. Robert Kinnear, Alternative Innovations. One point that was lightly touched upon was the addiction regarding sexual activities. When I've just returned from the West after a few months' absence, and I noticed there that there seems to be a great addiction to online pornography, and this is causing quite a problem in schools and relationships with young people. So I noticed there was a rather interesting solution to this was thrown out by one, I think, American journalist, suggesting that they might have, rather than sex education at schools, have discussions of mixed sex discussions after watching pornography to work themselves through it. It sounds quite remarkable to me, but I wonder your comments on that regarding Thailand, the problem of online pornography amongst younger people and how it affects relationships. And if I may just throw in another one just now, give you time to think about it perhaps. Another section of social community here in Thailand is refugees. I worked in Mela camp up in Mae Sot area 21 years ago now. Every 10 years I go back and I see it getting bigger and bigger, and now there's several generations of people have been born and brought up in the camp, so clearly creating a lot of stress amongst the community. And when I was back there last year on my second 10-year visit, I noticed there was a drug and alcohol centre inside the camp, but quite visible from the road. So is any of the mainstream work of the medical profession of Thailand having any inroads in refugee camps? Because it's not just the 40,000 in Mela, there's, I don't know, 200 or 300,000 up and down the borders still. Or is it just voluntary NGOs doing their work there, helping? Thank you.
So there are two questions. The first one on addiction to online pornography in Thailand, and then the mental health of refugees in Mela camp, and is there any service provided from what I understand?
Well, I can address the pornography addiction issue. We definitely recognize that pornography, especially for young people, can be detrimental. I mean, it's well established that it can give them an unrealistic expectation of intimacy, gender roles, body image. There's no real win, there's no real upside of young people being exposed to pornography. Unfortunately, with internet access being everywhere, it's easy for them to stumble across it, even unintentionally, through pop-ups or Trojans in their operating system, that type of thing. In Thailand, with It's a little bit different. With sex addiction, we tend to see somewhat different symptoms than we would in the West. In the West, pornography addiction, internet pornography is very common, excessive masturbation, that type of thing. Sometimes monogamous relationships, but with elevating levels of deviance, or the kink factor, as we call it, is common with sex addiction. In Thailand, we tend to see more interactive, less cyber-based, more interpersonal, because there's more access to dating opportunities or the sex industry. So what we actually find is a little bit interesting is a lot of clients seeking help for sex addiction. It isn't actually sex, it's more romance, love, intimacy, multiple partners, where the individual needs to find someone, pursue them, and once they're confident that they're in love or attracted, it fulfills their self-esteem, then they get bored and they need another partner. And these days, they're generally, that's done through their dating applications and that type of thing. So we see a little bit non-traditional symptoms for sex addiction in Thailand that we might see, let's say, in the US or Canada. But that said, with young people, there's definitely more potential that damage to be done in early development by pornography or even mainstream media sometimes. I think it's very important that parents monitor their children's views and their beliefs, what they're doing, and when possible, try to educate them that everything they see online is not realistic.
Thank you. On MELA camps, I don't know if there is a...
You know, I'm going to respond to that because I've been volunteering with the refugee organizations for the last 12 years. Mostly what happens inside those camps is regulated by a variety of international NGOs and self-organized community-based organizations. And I don't know, I know that they receive some support from Thai medical organizations around the camps. I can certainly say, of course, and there's also, the questioner didn't mention, but there's a sizable urban refugee population here in Bangkok. There have been some really great stories published in the media in the last couple of years for the very first time about this population. And it's been my experience that a number of Thai doctors and medical professionals at different hospitals have provided discounted low-cost or pro bono services when refugees have been in need. There hasn't been any systematic organization. In fact, what's actually happened is that a Taiwanese NGO has recently come into Bangkok and set up basically a free medical clinic for Bangkok's urban refugees, but all of the personnel are Thai medical professionals who are volunteering to work in a kind of monthly or bi-monthly clinic that they set up, and the refugees can go there and receive free medical services. It's an incredible, it's a fantastic development, and again, it's all the volunteer medical professionals, the nurses, the doctors, the techs are Thai. I don't know if that's a satisfying answer, but...
Please.
Okay, thank you. My name is Dr. Donald Johnson. I'm a psychologist who teaches at Webster University. And I just want to thank the staff for their expertise and their insights. I'm really enjoying I have two questions. I'll ask the second one first. It dealt with relationships among young people. And one of the common problems I've seen in the years I've lived here is that there are many teenagers and young adults who have parent relationships problems because their parents are working all the time or are unavailable. And these teenagers tend to be engaging in addiction disorders or risky behaviors, including drug use, gang fighting, and especially teenage pregnancies. Thailand has the highest teenage pregnancy rate in Southeast Asia, and it's the highest, it matches America's teenage pregnancy rate. So I was wondering if any of you could comment on how we can get parents to see the warning signs and how we can get teenagers to seek social support and counseling resources. That's the first question.
Because I'm a general psychiatrist, so I'm see the people in adulthood. So I'm not sure about the information about the younger age and the adult. So the teenager. So maybe, but the major concept of the government that we would like to give the people about the education to know how it's about the education about protect themselves from the sexual transmitted disease and the pregnancy in the teenager period. So after the survey, we found that Thailand got the very high rate of the teenager pregnancy. So the last 2 years, the government tried to promote more information in each school, especially in the junior high school and like
Elementary.
Yeah.
Higher elementary school.
In the higher elementary school. So they government support to let the school have the psychologist for each school to give the information to the parent. We found that the root cause of the early age pregnancy maybe it's not just the sexual activity, but maybe because of the family problem or the communication problem, and many other root cause. So that is the thing I can answer you now.
I think maybe basically it's a cultural thing also for Thailand. Sadly, sex is still a taboo subject to talk with parents, and parents also find it very uncomfortable talking about sex with children. So it's a cultural thing and a cultural barrier that we have to overcome, I think, eventually, because by talking, they would help teenagers a whole lot.
As other Asian country, the sexual thing is sometimes it's like a prohibited issue in the family. And as the last question about the pornography addictive or something, it's very compared to the Western country, the number of the client who come to seek the help is very low, because for the attitude of the Asian people and especially Thai people think that the sexual thing is like a shameful and it cannot accept to talk with other people even with the doctor or the psychiatrist. So they will wait until they cannot control the situation or very big problem happen in the family first they come to see the psychiatrist.
Thank you. The other question deals with, given that we have an underserved population with mental health professionals and psychologists, can you recommend any internship programs or graduate training programs in Thailand? And I'm particularly interested for international programs, in other words, English speaking. Because we have about 40 students that are looking for internships, so it's a self-interest.
Because I'm work as a psychiatrist, so I'm really not sure about the program for the psychologist. I'm not sure that Ben have information about that.
Learn Thai. I mean, if folks only speak English, it's extraordinarily difficult. It's extraordinarily difficult for them to find an internship. In our program, we've been quite flexible. We allow students, in the past, we've allowed students to complete their internships in their home countries, provided that we can verify, and there is a reasonable supervisor. And students again, a student who's interested might go to a refugee camp. Again, if a student wants to do it on some kind of 9 to 5 basis within, like walking distance of their home, that isn't going to happen.
Mm-hmm.
right? But if someone's willing to go to a refugee camp for a month or 2 months, they can provide yeoman service, right, and be of great help to a population that doesn't have many compassionate listeners.
Yeah, but you have to speak Karen. So.
Some of the folks there would receive services in English, or they can provide staff support services. Right, the NGO staff are also under enormous pressures, and many of them do speak English and could benefit from trainings and from having someone to listen to them as well. So that's another angle on it, because supporting the staff is supporting the refugees. International students have to be pretty persistent, pretty creative to find something. In terms of training programs in Thailand, the advice I always give to international students is go get your graduate training in your home country.
Well, what if your home country is Burma? I mean, we have 20.
I hope you're young. Yeah, if your home country is Burma, then you can probably learn some Thai and get good training here in Thailand, or Malaysia, or Singapore.
Okay, so Singapore.
But those things are developing really well in Burma. They've got Yangon University has reopened their psychology department, and they are getting a lot of support from Johns Hopkins and from some other universities, and I think they're going to have a great program within a couple of years.
But I understand that Assumption has a good program.
I just remember that Chulalongkorn University have the program for the international student.
At graduate level?
Yeah, graduate level.
Okay, good.
Maybe let's try.
It's very interesting you mentioned that they're from Burma. Interestingly, we at the Samaritans are seriously exploring the possibility of opening a Burmese hotline, because there are like over 2 million Burmese immigrants here, legal and illegal here, and there are lots of problems. So we are actually exploring this possibility, and if your students are interested, please ask them to contact us.
Yes, please.
Good evening. I'm Jirasan sorry. Yeah. Good evening. I'm Jirasan Pomansin. I'm Thai and I just working here. I have two questions. The question is for Ben and Craig in general. Ben have told in the beginning of this session that in the first 6 months you come to Thailand, you don't work, but you just look how Thai psychologists work. So I would like to ask you two, what is the difference in working environment and working culture between Thai and foreign psychologists?
I never had to face, in my training or in my work, I never had to face 1% of the challenges that my Thai colleagues face every single day. They work in an environment where people won't even talk about mental health problems. In their families, at work, where their medical colleagues won't even refer to them because they don't want a patient to say to them, what, you're saying I'm crazy? Right? So the kind of challenges that they face within their own organizations and the levels of stigma, and it's very difficult for mental health professionals when other people have stigmatizing attitudes, because then the mental health professionals themselves are kind of included in that aura and penumbra of stigma, right? And that is really stressful and demoralizing for folks. And the attitudes, I think that my Thai colleagues are kind of like bodhisattvas. I mean, they're absolutely again they're working against tall odds, with few resources, and they do a really good job. And they keep at it. They train their students. They see their clients. I think one difference, I think that's a mundane difference, is that the roles of psychologists, and I'm speaking only of psychologists at the moment, the roles of psychologists in Thailand are still very similar to what the role of psychologists were in North America in the 1960s, which is to say that you don't find Thai psychologists in private practice. And it's only in the last 5 years, last 6 or 7 years, that you find Thai psychologists working in the hospitals, right, in the private hospitals. So now, basically, Bumrungrad, Samitiway, Bangkok Hospital, they all have hired Thai clinical psychologists to work there. That wasn't the case 10 years ago. You didn't find them outside of Somdet Chao Phraya, Suan Prung in Chiang Mai, Sitanya Hospital, and the related hospital, working strictly in the public facilities of the Department of Mental Health, but it's expanding. And also they're getting integrated. The Ministry of Education, along with the Department of Mental Health, have done a remarkable job of bringing psychologists and mental health folks out into the schools, right, where the kids are. And again, they face enormous challenges. The teachers don't want them there. The parents don't want them there, because nobody. So they face a lot of resistance.
What about Craig? Okay, let's continue to the second question. I want to ask Dr. Apichat in general. Firstly, it is about sorry. It is like today we have more number of people who have mental condition in Thailand, and people are more aware of their condition. So, but our resources of psychologists and psychiatrists is like strained. They work really hard. So, what you have to do, or what is any plan to cope with the increase of the need of the services in Thailand?
Because of in Thailand, the number of the psychiatrists is very low. It's just already 600 psychiatrists compared to the 68 million population. So it's very few. And most of the psychiatrists nowadays maybe work in the big city like Bangkok and Chiang Mai and the Khon Kaen or something. Some provinces do not have the psychiatrists. The government try hard to increase the number of the psychiatrists by increase more the training school, but because of the training process is very it's not quite easy to open more without the good enough standard. So nowadays we try to open the training places, but yeah, of course it's still not enough. But compared to the last 10 years, the number is like 50% more, but it is quite good rate. But in the future, like 5 or 10 years, I think it will be double of the number of the psychiatrists. But the psychology, I'm not sure about the exactly number in the Thailand. But of course, it's not enough. But in many universities, they have they open the new faculty like a psychology faculty that very new for the Thailand. For the last 40 years, maybe the psychology is the small part of other faculty like a humanities faculty or from the social faculty. So in the future, I think the number of the psychologists and psychiatrists will be much better than this.
So do you think the number that is increasing will cope up with the increasing demand?
I think in the next 10 years, the number of the mental health professional will be more appropriate than now, because of the birth rate of the Thai people is not high anyway. So maybe the next 10 years, I think the number will be okay.
Yep. And the question 2.2, I would like to ask about the government support on healthcare, like universal healthcare and social security. How do they cope with cover with psychological illness or even therapy? Because I don't think we cover therapy session.
Actually, it's included.
Really?
In the 30 baht, the gold card system include the psychiatric treatment and the psychology treatment also. Yeah.
So it covers very Thai people. But
yeah,
we
cover for all Thai people, include the psychotherapy session.
Waiting list.
Yeah.
Yep. Thank you.
Thank you. If there are not any more questions, we will close the program now. Thank you very much to all the speakers. Please give a big round of applause.